Our sign language interpreter this evening is Damien Evans. Tonight, provision of medical services in most public hospitals remains paralyzed as clinical officers and nurses stay away from work. A spot check by KTN News in some hospitals reveals a sorry state of affairs as patients in some hospitals remain unattended while others have been forced to go back home. Now this as the Kenya medical practitioners, pharmacists and dentist union officials called out the political class for being insensitive to the welfare of the medical officers. And as Allan Ochanda now reports, the doctors have started a strike countdown with 13 days to go.
A spot check at Kapsabet County Referral Hospital in Nandi County and patients' wards are empty. Patients have been forced to go back home after the nurses and clinical officers' second-day strike meant no services at all. The few who are remaining have not been attended to and are a worried lot.
Naekewa madawa na hakuna kitu wananisaidia. Sasa nikawaambia hata niende nyumbani, wananiambia bado ukae. Sasa mimi niko tu naumia.
Wagonjwa wameweza kuambiwa waweze kufunga virago waende nyumbani na wagonjwa wao. Kwa vile ukiona kwenye vitanda hivi, wagonjwa wengi walikuwa wanalala hapa na wote walianza kuondoka kuanzia jana. Sasa hivi leo bado watu wanaambiwa waweze kuondoka waende manyumbani.
The situation has not been any better in Kisumu and Mombasa counties, where the health workers have not shown up for work. Only their officials reiterating their hard stance, demanding for PPEs and increment of risk allowances.
So far, we've had a single engagement where the county government of Mombasa was able to engage us in a discussion, and they gave us a proposal to return to work. But that proposal did not really capture our issues as we intended them to be. And therefore, due to this, we wrote back to them a counter proposal that was actually meant to actually demand that they do one or two things. And in that proposal, we said that the county government should be able to pay at least 3 months because we had all 5 months in arrears.
And we have gone to offices, knocked offices as union officials, but we are being taken round the circles. That's why we are saying that if the government is serious about some of these things, then they have to act and ensure that the frontline soldiers are given what duly belongs to them, and that is their salaries, in time and in the right amount.
The nurses and clinical officers have been decrying exposure to COVID-19, little risk allowances, and late payment of salaries. Tens of doctors have succumbed to the virus, with the latest being Dr. Stephen Mwagusu, and the doctors want the government to shoulder his medical bill amounting to 800,000 shillings.
His death and that of 12 other doctors have brought to core the welfare, occupational safety and health of all healthcare workers in this country.
Ombi langu ni ministry tukikutana siku ya Alhamisi wawe wamemalizana jukumu lao, pia jukumu la county governors, kwa sababu wengi ambao wako kwenye counties wako directly under the governors.
With the ever-rising coronavirus cases in the country, Kenyans had banked all their hopes in the hands of the healthcare workers. But the healthcare workers are wounded even more, and now most of them have downed their tools in most parts of the country. And now the doctors have threatened to follow suit in the next 13 days, even as they call out the political class over what they termed as insensitive remarks. Allan Ochanda, KTN News.
I would like to hear your thoughts this evening on the big question we are asking. What do you think is the best way to resolve the current health crisis? What do you think is the best way to resolve the current health